Healthcare is becoming all too common.
So today, a new law has been expanded to make sure that help is immediately available. Medical reporter Liz Bonus joins us now to tell us about it. Liz?
Hey guys, good evening. It is hard to think of anyone going into a hospital for help and assaulting those trying to give that help, putting patients and staff in danger. But that's what healthcare providers say now is all too common, a reality for them. So today, a law that protected emergency room workers was expanded to cover all healthcare providers and, of course, all of those around them and patients too. And it's mainly because of the kind of problems now being reported.
That can be anything from being hit, pinched, slapped, spit on, punched, having a knife held up to you and being backed into a corner. It can be very frightening at times.
Linda Robinson, one of many at this news conference today at St. Elizabeth in Florence, saying that violence is up in healthcare centers for a number of reasons.
With the issues of the opiate addiction, violence in healthcare has become more prevalent, and this will give our police the ability to deal with those individuals affecting our staff.
So at this ceremonial signing, Governor Matt Bevin expanded a bill from emergency workers only
now we're going to actually sign one and you all can do whatever you want
to the rest of the staff anywhere in the hospital. When it all began back in 2012,
a lot of other states had bills, but yet they covered just clinical folks, or they covered certain job descriptions, and we decided to cover everybody, so that was kind of unique.
The law works like an expanded domestic violence law. If a healthcare provider reports a problem, these law enforcement officers can take immediate action.
You know, sometimes the alcohol and the drugs fuel this, and so that's why it's nice to have the police to be able to come in, do something about the situation so that we can, again, take that environment back to a safe, healing environment.
Safe healing environment kind of says it all. Really, this covers you if you're in a hospital or a healthcare setting as well. If you saw something happen and you tell a healthcare provider, they then can tell someone who can call authorities right in.
Oh, that's
it's just
great.
like with domestic violence, if you just say something, then you can get help.
Sure,
Yeah.
and it's important right now.
It is really important right now. By the way, Ohio and Indiana have similar laws, but they're all just a little different state by state.
Okay, thanks, Liz.